حمدا لبارئ الأنام، ثم الصلاة والسلام ما ناح في دوح الحمام على الرسول العربي وآله وصحبه ومن تلا من حزبه سبيله في حبه على ممر الحق بي. اللهم لسان زلات فاغفر زلات ألسنتنا والكلام سقطات فاغفر سقطات كلامنا، وأنت المثبت فثبت قلوبنا على الطاعة واعصمها من المعصية واجعلنا في سائر أمورنا خيرا. اليوم today it's the thoracic wall blood supply for Dr. Olina. So this is gonna be very quick explanation. Inshallah it's gonna be easy. طيب, objectives. No. This is also a drawing. It's a good drawing, but I'll just explain from the slides. It's better. Okay, so you have two intercostal arteries. You have posterior intercostal arteries and you have anterior intercostal arteries. First of all, let's start with the anterior. Anterior intercostal arteries from 1st to 6th will be from the internal thoracic artery. Internal thoracic artery, you have the subclavian artery, and then a branch of it is the internal subclavian artery, and then it will branch off and gives the intercostal arteries, the anterior intercostal arteries for the 1st, 6th intercostal spaces. And then this internal thoracic artery will also branch off and become the musculophrenic. The musculophrenic is going to go like this. Okay, you have the internal thoracic and then the musculophrenic, and the musculophrenic will provide for the 7th to 9th intercostal spaces, arteries to the 7th to 9th intercostal spaces. Okay, now what about the posterior? The posterior, first you have the first two intercostal spaces coming from what we say posterior superior intercostal artery, that comes from what? The costa cervicatum, also from the subclavian. So you have the subclavian artery, you have the internal thoracic, and then you have the superior intercostal artery. And this superior intercostal artery will provide the first two intercostal spaces with arteries. And then you have the descending aorta. So you have the ascending aorta, arch of aorta, and then descending aorta. Now the descending aorta will provide arteries for the 3rd to the 11th intercostal spaces. So every intercostal space from 3rd to 11, it will have the artery posteriorly will come from the descending thoracic, and then you have a subcostal artery for the 12th rib, because you don't have a 13th rib unless you have some insane genetic defect. You don't have a 13th rib, so the artery that's going to be below the 12th rib, it's going to be a subcostal artery. So as we said, there's the internal thoracic, and then one of its branches is the musculophrenic, but then it also have other branches, the perforating arteries, which accompany the nerves into the mammalian gland. What is the mammalian gland? Your breast. So the skin, and then what is that gland? That's where the perforating artery goes to, or branch off to. And then you have the pericardiophrenik artery. So you have the phrenic nerve, and then you have the pericardiophrenik artery going with the phrenic nerve into that area. And then you have the superior epigastric artery. It goes under the abdomen. It cuts off the diaphragm and enters, and it supplies the upper half of fructus abdominis, so the upper half of your abdomen. And then you have the musculophrenic that we said, the internal thoracic goes like this, and then the musculophrenic goes like this, which should supply the 7th to 9th anterior intercostal arteries. Now we have the coarctation of the aorta. It's a congenital cause, so it's a genetic defect where after the arch of the aorta, there is some narrowing on the aorta. Now what will this narrowing cause? It will first, of course, cause the it will cause the descending aorta and all its branches under the coarctation to have lower blood pressure. And what does the descending aorta supply? It supplies almost all the lower abdomen and lower limbs. While, okay, if this has lower pressure, that will mean that blood will stay in the upper half, which will cause what? Increase in blood pressure in the upper extremities and upper limbs. So you, as they said, how do you know that there is a coarctation of the aorta? If you measure, for example, the blood pressure of your leg or of your abdomen, there is going to be low or very low compared to the high blood pressure that you're gonna see maybe in your carotid artery or the subclavian artery or in your arm, because these are in the upper limbs, while your leg is in the lower limbs. Now, how is that related to our lesson? As we said, you can see it in rib notching. Okay, how's the rib notched? How is it defected? How is it degraded? The cause is because of the high blood pressure in the arch of the aorta and all the ascending arteries that comes out of it. What are the ascending arteries that come out of it? One of them is the subclavian artery. What we said, the arteries that comes off the subclavian artery, you have the costocervical trunk, which provide the posterior, the first two posterior intercostal arteries, and then you also have the internal thoracic artery, which provide for the first six anterior intercostal arteries, and also branch off into the musculophrenic, which provide to 7th to 9th anterior intercostal arteries. Now, if the subclavian artery has high blood pressure, the anterior intercostal arteries will also have high blood pressure, because they come of the thoracic artery, internal thoracic artery, which comes from the subclavian. So subclavian has high blood pressure, internal thoracic has high blood pressure, the anterior intercostal arteries will also have high blood pressure. So what will that cause? The pressure in these arteries will literally degrade the rib and will to notch it. So the high pressure, like erosion with water on the stone, same thing with the artery. The artery will just have a lot of pressure that over time the rib is going to be notched and degraded. So that's basically it. Now we go to the veins. Veins are very, 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 very easy. Intercostal veins. So posterior intercostal veins, if they're on the right side, they are drained into the azygous vein. If they are on the left side, as we see here, if they're on the left side, they could either to the accessory hemiazygous or the posterior hemiazygous. For your information, I think you just need to say, where do intercostal veins drain to? Hemiazygous, the posterior, to either the hemiazygous or the azygous vein. And also the hemiazygous and the accessory hemiazygous will all then go drain into the azygous vein itself. Now, what about the anterior? Well, the anterior is the same as the arteries. So we said that the arteries in the anterior are supplied by the internal thoracic and the musculophrenic. Same thing here. Internal thoracic and musculophrenic veins. Very easy. Lymphatic system, you all know the thoracic duct, the lymphatic duct. You have the thoracic duct, which is in your left side, and it basically drains 3/4 of your body except the upper right side of your body, which is drained by the right lymphatic duct. So I'll just give a picture here. As you can see, this is the thoracic duct, this is the thoracic duct, and only this half or quadrant, upper right quadrant, is to the right thoracic duct. And where do they drain? They drain into venous angles, which is, how when the subclavian and the jugular vein join together and form the brachiocephalic, there is an angle there. That's where the thoracic duct and the right lymphatic duct drain into that venous angle between the two veins. Yes, the internal jugular and subclavian veins. So for this, you just need to know that the thoracic duct, like, because lymph vessels, they are vessels too. So you just need to say that it starts with the cisterna chyna, which is from the I think the digestive system, but I don't think that's much open, and passes through the aortic opening, and then posterior mediastinum, right of the aorta, just right to the aorta, and it's posterior to the esophagus, so it's behind the esophagus. And then we said that because the thoracic duct is for third quadrants except the upper right, so its duct, it's going to be on the left side, the left venous angle between the left subclavian and left internal jugular vein. And the right lymphatic duct is just for your upper right half, so the upper right half of your head, of your arms, everything. That's all the lymphatic vessels drain into there. Also, there is no lymph vessels in the brain, I forgot. And now the nerve is also very easy. You have the dermatomes, which is the area of skin that is supplied by one thoracic spinal cord, because the spinal cord is divided into 12 sections in the thoracic area. You just need to know T4, I think, and T10. T4 is basically the area of the nipple, and T10 is the area of the umbilical. See? T4 and T10. So dermatome is basically the area of skin that is supplied by one spinal cord area. I don't know what's its name, to be honest. I forgot. Okay, so intercostal nerves. Now we have intercostal arteries, intercostal veins. So of course you'll have intercostal nerves. So how does it start? So we have gray and white communications. So this is basically the ganglia and the sympathetic trunk, all of this. Then you have anterior and lateral cutaneous branches. So it's basically the branches that go like anteriorly in your skin and posteriorly into your posterior skin, your back. And it also goes to, as I said, the skin of the thorax and abdomen, palatal pleura, parietal peritoneum, all the skin that is just on the surface. And then you have motor branches, because if you have the cutaneous branches, is basically most of the time it's most of the time sensory. You'll have motor branches for the muscles that you have. So you have the intercostal, anterior, and the abdominal wall muscles, because when you breathe, you need when you breathe in, your abdomen relax and your diaphragm contract, but when you relax, your abdomen contract while your diaphragm relax. But this, you don't need to memorize this till now, but it will come in the future. But for now, just know that there are motor nerves that supply the muscles in that area. And then you have the collateral branches, which basically goes in the which ascends from the angle of the rib. So where the rib articulates, that ascends from there, and helps supply intercostal muscles too, and parietal pleura, which is basically the membrane of your lungs. Now we have atypical intercostal nerves. Now you know T1 is part of the brachial plexus in the that's between the cervical and the thoracic vertebra, or the thoracic spinal cord. So it gives off brachial plexus, and then you have T2, which gives off intercostal and intercostal brachial nerve. So it has part that goes into an intercostal nerve, and it has part which becomes a brachial nerve, medial cutaneous, which is basically this, the one that when you feel a heart attack. In coronary artery disease, pain is referred along this nerve to the medial side of the upper limb. So you have the arm, like this is my arm, right? Okay, this is my arm, it's in this side, medial cutaneous. Herpes zoster infection. I think everyone when they were a kid, I don't know, that got the chickenpox, jidari. So it's basically it's a virus which goes to the spinal ganglia in that dermatome or in that area, right? And just infect that ganglia. So that's why you have this specific rash, or what they said, vesicular eruptions, because the difference between rash and vesicular eruptions have like these dots that have fluid inside. So if it has fluid inside, it's a vesicular eruption. But I'll just call it rash for the sake of understanding. It just goes around into the specific area, which basically symbolizes resembles the dermatome of that ganglia, what nerves it supplies. So when you first have it, and then it will stay dormant in your spinal ganglia. So for example, I had chickenpox when I was a kid, and that virus is in my spinal ganglia now. And la subhanallah, if I get any immunodeficient disease where immune system is very weak, I will get this infection again. لا سمح الله ان شاء الله ما يجيني، اعوذ بالله، اتذكر كان اسوء مرض في حياتي. لا الله يبعدنا منه ومنكم هذا المرض. And where is the dermatome? At first I remember at M2 we told him, is it T4? I said no, it's below the nipple area, so this is considered T5. So if you get a question, what's the you say T5, okay? And basically eruption, sharp pain in the dermatome, because it affects the spinal ganglia, which will then branch into the supplied nerves. So that's why the sharp burning pain that is supplied by the nerves. So red and vesicular eruptions. And we're done. I think it's very easy. It's just memorization. You need to memorize. There's not much explanation to do, but inshallah it's going to be easy for you and for us.